Makers of organic and gluten-free old-fashioned rolled oats for whole grain breakfasts are making oatmeal cookies. Available at Target and at bobsredmill.com.
Programming is supported by Bet Shalom Congregation in Minnetonka, where adults can now enroll in online courses, A Taste of Judaism and Judaism 101. To register, go to betshalom.org. Bet Shalom, you belong here.
Good afternoon. I'm Stephen John here on NPR News, inviting you to stay tuned as the Minnesota Department of Health is about to brief reporters on the latest information regarding COVID-19 in our state. Time permitting, we will join up with National Public Radio's Here and Now program. Minnesota Health Commissioner Jan Malcolm is once again scheduled to lead the conference call, as she has done many times here on our air during the past 19 months or so. Also expected to take part is Dr. Ruth Linfield, state epidemiologist and medical director, as well as Kathy Como-Sabetti, manager of the COVID-19 epidemiology section. On the national front, U.S. regulators are expected to rule today on authorizing booster doses of the Moderna and Johnson & Johnson vaccines, and children ages 5 to 11 will soon be able to get a COVID shot, as the White House detailed plans for the expected authorization of the Pfizer jab for elementary school youngsters in a matter of weeks. Commissioner Malcolm will likely have something to say about that, about the vaccine situation, after she gives an update on the COVID statistics, which have been looking more encouraging this week, although today there were 32 additional deaths associated with the virus, along with more than 1,800 new confirmed or probable infections. Should mention quickly the major non-COVID development we're following today. The Biden administration has ordered a study that could lead to a 20-year ban on mining upstream from the Boundary Waters Canoe Area Wilderness, dealing a serious blow to the proposed Twin Metals copper-nickel mine. The Obama administration tried to kill the long-in-the-works project when it launched a similar process, but the Trump administration reversed that decision. We'll have much more on that development here this afternoon on the air and online. We'll also have much more on the COVID situation in the hour ahead. Also should mention that Governor Tim Walz announced a further expansion of rapid testing availability at community sites across Minnesota. This week, the state is launching new COVID rapid testing sites in Stillwater, Crookston, and Hutchinson. New rapid testing sites will also launch next week in Inver Grove Heights, Wadena, Hibbing, and Albert Lea to serve Minnesotans in the community. Those sites are being supported, incidentally, by the Minnesota National Guard. We heard, last week about the Guard being called up to perhaps aid in long-term care settings during the latest surge in the virus, and hopefully we'll get an update on that coming up here in the next little while as reporters dial in, get set to listen in to Health Commissioner Jan Malcolm, and then have their chance to ask questions of the top health official in the state of Minnesota. Here on this Wednesday, October 20th, it's about 3 minutes after 1 o'clock. Now, this call coming in the 1 o'clock hour as opposed to the 2 o'clock hour. Not sure why the timing worked out the way it is. But here now, Jan Malcolm in the background. Let's go live on NPR News.
1,858 new confirmed cases of COVID and, unfortunately, 32 additional deaths. This brings our cumulative totals to 765,761 confirmed cases, and 8,489 of our fellow Minnesotans lost to COVID-19. All of our 87 counties are still listed as having high rates of transmission by the CDC. We have 935 COVID patients in the hospital, including 240 in the ICU. Capacity does remain tight, particularly for pediatric beds. Our latest data show several regions of the state with 0 pediatric hospital beds available. Vaccination, as you know, is our most powerful protection measure, and we're grateful that an additional 2,179 people got their first vaccine dose as of today's figures, and 2,291 completed their vaccine series. We now have just over 73.3% of Minnesotans age 12 and up, so those who are vaccine eligible at this point, 73.3% of the eligible population had at least one dose. Every vaccination is good news for the individual and for everyone around them. Makes us more resilient individually and as a community. And every vaccination helps reduce the pressure on our healthcare systems and our healthcare workers. I'd like to just comment on the expansion of testing that Governor has ordered and we've been standing up. Earlier today, the governor announced that the state is launching new rapid testing sites specifically to respond to the growing demand for rapid testing. New sites in Stillwater, Crookston, and Hutchinson. The Stillwater site opens today. Crookston and Hutchinson open tomorrow. And additional rapid testing sites will also launch next week in Inver Grove Heights, Wadena, Hibbing, and Albert Lee. As you know, the governor activated the National Guard last week to support the expansion of this effort, and we are grateful for the Guard's support in helping very quickly to stand up these rapid testing sites. We'll also begin offering rapid tests at our existing community saliva testing locations in Moorhead and St. Paul beginning in today, and Brooklyn Park and Duluth beginning on Friday. Minnesotans are navigating daycare, school, and work in the middle of a pandemic, and rapid testing can help them get the fast results they need to make the right decisions to protect themselves and those around them. As we've talked about before, these rapid tests are intended for people experiencing COVID-19 symptoms. And they take an antigen test and receive those results very, very quickly. In addition to the new state rapid testing sites and rapid options at existing state saliva sites, Governor Walz also announced that additional COVID-19 rapid testing opportunities are being stood up with local public health agencies around the state. 16 local public health agencies are also deploying rapid tests that we provide to them. And some of these will be used at community testing clinics, while others will be used for targeted efforts. These participating agencies will announce their testing plans and appointments processes. We've been steadily expanding testing capacity throughout Minnesota to meet the increasing demand that we've seen in recent weeks. To tackle the Delta variant, we opened new community sites in Bloomington, Lino Lakes, Minneapolis, St. Paul, and Morris just since August. And the state has also added weekend testing hours and doubled our capacity at the Duluth community testing site and added an additional day, Friday, testing at the state sites in Mankato and St. Cloud, Sunday testing at Moorhead and Winona. As a reminder, testing is free at all of the state's community testing sites. And again, the rapid tests are specifically for symptomatic Minnesotans. More detailed guidance on who should get tested and how to use the results of the test can be found on our COVID-19 testing webpage. I also want to talk today about some important new data that we are adding to our website and our situation updates, and that is a new graph and a new chart to add more clarity to the vaccine breakthrough data that we have specific to Minnesota. And that, again, will be shown on our COVID-19 page at NDH. What we're adding today is a graph showing weekly age-adjusted rates over time for cases, hospitalizations, and deaths by whether or not they are fully vaccinated. There will be a chart showing rates by age group for cases, hospitalizations, and deaths by whether or not they are fully vaccinated. And a couple of key data points that these graphs and charts show as an important kind of takeaway. Based on this age adjustment, which is an important way of kind of normalizing the data, our Minnesota data show that if you are not fully vaccinated, you are 15 times more likely to be hospitalized than those who are fully vaccinated. And those not fully vaccinated are 30 times more likely to die as a result of COVID-19 than those who are fully vaccinated. And again, you can see on these data how that breaks down by age group and how that has changed over time. It's a significant addition to the information that I know many of you have been asking for. This really does just show, again, the key point that the current wave of COVID infections is concentrated heavily among people who are not fully vaccinated. And it shows that the infection risk is there for all age groups, not just older Minnesotans. These additions provide another way to look at vaccine breakthrough data and, again, to quantify that the vast majority of cases, hospitalizations, and deaths in Minnesota are in those who are not fully vaccinated. These COVID-19 vaccines are incredibly effective. However, a small percentage of people who are fully vaccinated will still get COVID-19 if they are exposed to the virus that causes it. This is normal with any vaccine to see a percentage of vaccinated people still get sick. These are called vaccine breakthrough cases. And that is when a person tests positive 14 or more days after their final dose of vaccine and the person has not previously tested positive for COVID-19. We've been actively monitoring and tracking these vaccine breakthrough cases to better understand what's happening in Minnesota. We do know that vaccine makes illness less severe in people who get vaccinated but still get sick. Fully vaccinated people are much less likely to be hospitalized or die, as we've heard, than people with similar risk factors who are not vaccinated. Vaccination does continue to be our best prevention measure against this surge of COVID-19 and potential future surges. It's important to note that around the world, we are still seeing over 500,000 or around 500,000 cases every day. And that's of concern because that's the breeding ground for future variants. So vaccination is critical now, and it's critical for ongoing protection into the future. We encourage everybody who's eligible to get vaccinated as soon as they can. And we also want to, again, encourage people to practice layered mitigation in areas where COVID-19 transmission is high, and currently that is all of Minnesota, which means people are advised to mask in public indoor settings, to be mindful of social distancing, and to absolutely stay home when sick and get tested as appropriate. With that, I'd like to turn it over to Dr. Linfield.
Thank you very much, Commissioner Malcolm. I want to update you on holiday guidance that has been issued by CDC. We're approaching several important holidays for Minnesotans of all ages. And with that in mind, CDC recently updated their holiday guidance to reflect the changed landscape that we find ourselves in. While COVID remains a serious concern in Minnesota, there are ways to enjoy holiday traditions while still protecting your health and the health of others around you. CDC's updated guidance is available online at cdc.gov. It reflects the fact that multiple generations tend to get together to celebrate holidays, and the best way to minimize COVID-19 risk and keep your family and friends safer is to get vaccinated if you're eligible. Remember, your vaccine protects you and it protects those around you, especially those under 12 who are not yet eligible to get the vaccine. Following the layered mitigation theme, the CDC guidance also emphasizes some other protective measures, including wearing well-fitting masks over your nose and mouth if you are in public indoor settings, if you are not fully vaccinated, and even if you are fully vaccinated, if the community is experiencing substantial or high levels of COVID transmission. I also want to remind you that per federal rules, everyone needs to wear a mask, even if they are fully vaccinated, on public transportation, including planes, trains, and buses. Remember, outdoors is safer than indoors, and it is important to avoid crowded, poorly ventilated spaces. Also keep in mind that if you have symptoms, or are sick, you should not attend a gathering or host a gathering. And please get tested if you have symptoms of COVID-19 or have close contact with someone who has COVID-19. If you're considering traveling for a holiday or event, visit CDC's travel page to help you decide what is best for you and your family. CDC still recommends delaying travel until you are fully vaccinated. Refer to the page regarding testing recommendations and potential quarantine following travel. You might choose to wear a mask regardless of the level of transmission in the community, even if you are fully vaccinated, if a member of your household has a weakened immune system, is at increased risk for severe disease, is unvaccinated, or if you want an extra layer of protection. People who may not respond well to vaccine because they have a weakened immune system should continue to wear masks even if fully vaccinated. And if you are gathering with a group of people from multiple households and potentially from different parts of the country, you could consider additional precautions such as avoiding crowded indoor spaces before travel, taking a test, a COVID test, in advance of gathering to further reduce the risk. By working together, we can enjoy safer holidays, travel, and protect our own health, as well as the health of our family and our friends. And at this point, I would like to turn it back to Mike Schomer. Thank you.
Thank you, Dr. Linfield. Operator, we're ready to take questions.
You're listening to a live press briefing on the latest situation with the coronavirus in Minnesota here on NPR News. Reporters now getting set to ask their questions.
Our first question comes from the line of Chris Megan from Pioneer Press. Your line is open.
Sorry about that. My phone was muted. So I just want to say it's good to see that you're providing more information about breakthrough cases, but quite honestly, this information is a little bit confusing, and I'm just wondering why you can't provide us with more detailed, specific information about, like, for instance, when things such as deaths, you have here, the numbers per 100,000 people back in September, the week of September 15th. We had roughly 90 fatalities reported that week. Why can't you just tell us how many of those 90 fatalities were people who were vaccinated versus unvaccinated? I don't understand why that information is so hard to get.
This is Commissioner Malcolm. As Mike mentioned, we have Kathy Como-Sabetti on the line as a resource, and Kathy leads the EPI section specifically focusing on COVID. So, Kathy, I wonder if you could help to respond to that.
Sure, yes. I mean, we're certainly doing the best we can to keep all of our information updated and provide people with the most updated information that we possibly can. One issue about the delay in reporting if someone has passed from COVID and their vaccination status does have to do with the systems that we have to match an individual to a vaccination record. These do take time. There are some delays in identifying deaths, as well as delays in having those data match and having the information in our Minnesota Immunization Registry. All of these systems are working very hard, again, to be as updated as they possibly can, but there are some understandable delays so that we can be as accurate in these data as we possibly can. We really do not want to release information that is inaccurate only to retract it later. The other thing is I would say, the age adjustment here is very, very important. That certainly the risk of COVID changes with age. The likelihood of being fully vaccinated changes with age. So we believe the best demonstration of these data are the age-adjusted rates rather than an individual being vaccinated or unvaccinated.
Thank you for that, but I would just add that I think everyone understands the time delays and some of the uncertainty in the information, but there is a very large demand out there for people to have a better understanding of the rate of death among people who are fully vaccinated. And as far as I can tell, none of the information that NDH releases on a regular basis really gets at that. If it takes a month in order to find, to solidify those numbers, it's hard for people to understand. And there doesn't seem to really be a solid data point out there. Is there? I mean, can you tell us what the data points are that you do know? I mean, how far back would you have to go in order to be confident?
Kathy or Ruth, can you say more? I think we do know that these are rare occurrences, and we also think it's relevant to look at national data, which is because of the rareness of some of these breakthrough occurrences and the consequences of them, that national data is probably more robust at this point. But would one of you like to try again to answer Mr. Magan's question about what does this say? I think it's interesting to just make sure that what we think the data say are coming through clearly.
Kathy, do you want to give her a shot and I'll follow up?
Sure. I think, the commissioner said very well in her opening remarks what the data say. And the data certainly say that if you are fully vaccinated, you are much less likely to become a case, much less likely to be hospitalized, and much less likely to die of COVID. And I think regardless of the timing of that, certainly something's changed over the period of Delta, regardless of whether it is looking back a month ago or 2 weeks ago, the data have the same theme, that vaccination is our best protection against hospitalization and death, and also becoming a case itself. Ruth, anything you'd like to add?
Yeah, so we have also shared in the past, we participated with CDC and with 13 other jurisdictions looking at this issue of how much the risk increases if you are unvaccinated versus fully vaccinated. And you'll see in that report, which was released, I think in September, there was an early release for it. So it first came out, I think, a couple of weeks before it published. But there, I think it was on the order of you were 5 times less likely to be a case and over 10 times less likely to be hospitalized or die if you were fully vaccinated. Our data, which is a smaller data set, is consistent with the theme, as Kathy said. If you're hospitalized, if you are fully vaccinated, you are 15 times less likely to be hospitalized with COVID if you are infected versus someone who is not fully vaccinated. The question was around deaths, and I just want to say sometimes the death investigation takes a little bit of time. We review our vital records data, we review the deaths in hospitals, we have a number of sources, and we go back and we want to confirm whether there is solid evidence of COVID and that COVID was involved. And so there is a longer lag period for death. And as you know, we have over time updated the data. And so in looking at our current data, our number is you are 30 times less likely to die. That may change a little bit in a month or two if depending on the numbers, but it won't. The theme won't change. You are much less likely to die if you are fully vaccinated. And as the commissioner said, in our jurisdiction, the numbers, fortunately, are small for breakthroughs for deaths, and so looking at it on a national level is very helpful. Thank you.
Maybe I'm not asking the question correctly, but you've reported roughly 46,000 breakthrough cases out of how many total cases? You've reported 2,178 hospitalizations that are breakthroughs out of how many total? The 263 deaths, is that out of every death you've reported so far in 2021, or what's the denominator there? We're just trying to better explain to our readers what the impact is.
So, yes, that would be out of the denominator would be the total cases, it would be the total hospitalizations, and the total deaths.
And I think we have been reporting the percentages that those numbers represent, Chris, as you're asking. And someone can correct me if I'm wrong, but I think that that calculation is still on the web page, or if it's not, we can put it back on.
What we report, Commissioner, is the number of breakthrough cases out of the total number of fully vaccinated Minnesotans.
And I just want to remind people, when you look at those new graphs, there are drop downs from which you can select whether you'd like to look at cases, hospitalizations, or deaths. So if you pull up the web page, you see the case information, and you do need to select if you want to see hospitalizations or deaths. That data is on the website with those age-adjusted and then age-stratified or in age group. Both of those pieces are information on the website.
Thanks,
Chris,
Kathy.
this
It's
is Mike.
important
We'd be
to point
happy
out that you can. Go ahead, Mike. Sorry.
Yep. I was just going to say, Chris, we'd be happy to talk with you more, but we do have a number of other reporters on the line who have questions, so I want to make sure we give them time as well. Operator, I think we're ready for the next question.
Your next question comes from the line of Bill Werner from Minnesota News Network. Your line is open.
Hi, Commissioner, and maybe Dr. Linfield also. It looks like based on the announcement from the White House, we're getting ready potentially for an authorization for vaccines for those age 5 to 11. So a couple-part question here. Is Minnesota ready to go with that, even to the level of making those vaccines available in schools? And the second part of my question is, do you expect a significant amount of vaccine resistance from some parents who might say, well, this has been a long time coming, maybe it's not the authorization from CDC I'm talking about, maybe it isn't as safe as we really want it to be for very young children? Thank you.
Well, thanks for the question, Bill. And we've been working hard on planning for the administration of vaccine to 5 to 11-year-olds for some time. And we do have, we talked about this before, a really robust ecosystem, if you will, of vaccinators. We have, hundreds and hundreds of providers who are registered as vaccine for children providers, and they produce great results on pediatric vaccines in general. So we've got sort of, pediatricians and local public health and community clinics and all those folks who are, regular pediatric vaccine providers. And in addition, we are looking, and pharmacies are going to get a direct allocation from the federal government in addition to what the state gets to do pediatric vaccinations. And we know that, the numbers and the locations of pharmacies that intend to do that. And in addition to that, we're looking at what other kind of community site strategies, including school-based clinics, will augment that capacity. And we know that a lot of schools and school districts have expressed an interest in doing school-based clinics. We know that a large majority of local public health agencies are planning to partner with schools to do that. And in addition, we'll continually be looking at where are there some gaps in that infrastructure? Where do we think we need to maybe add some additional community testing resources? to meet that demand. And your question about what do we expect, I think there's been some national polling that, somewhere around 34% of those parents polled, say they intend and are eager to get the vaccine as soon as possible. And there are, other groups of folks who do have questions, and those questions need to be answered by trusted spokespeople, pediatricians, specifically in terms of the effectiveness and the importance of the vaccine. So we're working on, communications campaigns and, very detailed sort of implementation plan. We have been working on it for a while, and we will absolutely be ready to go just as soon after the CDC eventual authorization, which we do expect. I think, right around the 4th or so of November. So all of our planning is geared to be ready by then.
Commissioner, just a quick follow-up, if I may. You, as trusted public health professionals, can you tell Minnesotans with confidence that a vaccination, I understand it's a reduced dose, that if approved for this age group, that it's as safe as for adults or for the 12-plus category?
It's a really important question. It's vitally important that the public trusts and understands the rigor of the process of approval. And, all of this planning is in anticipation of a positive recommendation from the FDA and the CDC after close look at the data on effectiveness and safety. But nothing happens until that approval is done. So, Dr. Linfield, or Kathy, would either one of you care to say anything more just about the rigor of that process? Because I think, Bill, that's what we would be relying on to assure Minnesotans of the safety in particularly this age group.
Yeah, absolutely right. And the other piece to keep in mind is that children do get sick with COVID. Some children go on to develop long COVID. We're only beginning to learn about that. We do find that with adults, it may be on the order of 30% go on to have long COVID. And I do just want to circle back because CDC just published an MMWR yesterday that looked at vaccine effectiveness of the adolescent group. And they found that amongst the 12 to 18-year-olds, that the Pfizer vaccine was 93% effective in preventing hospitalization. And we do know that children in general have less of a risk of severe COVID than adults, but they do get sick. And it's similar. We recommend influenza vaccine for kids because they can get severely ill. And so, yes, these federal bodies are looking carefully at the data, but COVID is not something we want our kids to have. Thank you.
Thank you both. Appreciate that.
Your next question comes from the line of Catherine Richards from Minnesota Public Radio. Your line is open.
Yeah, hi. Just kind of jumping off the logistics question around getting this vaccine out to kids and talking to healthcare providers in the last couple of weeks. The thing I'm hearing from them is just some concern about being the main source of vaccination for this age group. They've pointed out that it's not, vaccinating kids isn't as simple as having like a huge vaccination clinic like we've had for adults. And given the labor shortages they're already facing, they're worried that they're going to be able to handle capacity. Is the state contemplating any efforts to kind of take the burden off healthcare providers as we start to vaccinate this next group?
The short answer, yes. I mean, we're certainly aware of the capacity constraints on our healthcare providers. We know that, pediatricians in particular are a bedrock of childhood vaccinations, and we expect they will play a very significant role in an ongoing effort to do vaccine. But we absolutely expect, in those first few weeks when there might be a particularly high demand, that we need to have really all the vaccine channels ready to help. It's just not the case that we assume that the healthcare providers will handle the bulk of it. Pharmacies, we're a significant source of vaccination for the 12 to 17 group. And so, we think pharmacies will be a convenient option for a lot of people, but not for everyone. So some will want to schedule through their pediatrician, some will want to use community pharmacies, some will want to utilize school-based vaccine clinics, and we are really preparing to be able to do all of that. So definitely aware that the healthcare capacity, provider capacity, needs to be augmented, and just mindful of how hard when we talk a lot about the stress on the healthcare system, just in providing all the acutely needed care that they are right now.
Okay. So another question kind of unrelated here. I'm wondering what the latest data is showing around the effectiveness of masking in schools. I mean, the assumption is that masking in schools will prevent transmission, right? But I'm wondering if we actually know or can see at this point, 6 weeks into the school year, whether we're seeing more transmission in school districts that don't have masking policies versus transmission in districts that do have masking policies.
Yeah, again, Ruth mentioned CDC MMWR's, the Morbidity and Mortality Weekly Review, and there was one of those several weeks ago that showed that schools and school districts with universal masking policies, at the beginning of the school year and continuing, are 3.5 times less likely to have outbreaks in their facilities. And so we have not replicated that data in Minnesota, but continue to watch those trends very carefully. We think that national stat is probably holds true here. But Kathy or Ruth, anything more that you can say on that?
I believe I agree that the national information and time again what we've seen from various studies about masking show the effectiveness in schools. There's no reason to believe that Minnesota would be any different.
Okay, thank you.
Your next question comes from the line of Paul Scott from Forum News Service. Your line is open.
Hi, I was thinking about that confusion early on, and I'm wondering if you can elaborate on the statistical rationale for why you report breakthrough cases, hospitalizations, and deaths as a percentage of fully vaxxed Minnesotans and not as a percentage of those who are sick, hospitalized, and died. My understanding is that as vaccination goes up, that ladder will get higher, which is a good thing.
Kathy or Ruth?
Yes,
I think
Kathy.
that's sort of a reframing of the earlier question. Yeah.
Sure. It's a very good question. I think people want to look at that. What is the proportion of our cases that are vaccinated and not fully vaccinated? The issue becomes around the proportion will increase as you have a larger group of people who are fully vaccinated, which is a good thing. But we've increased that denominator over time. It's not to say those are bad data. They just can be misunderstood as showing a decrease in the vaccine effectiveness rather than an increase in the population that is vaccinated. It is why our EPI team, and I want to give a lot of thanks and congratulations to our EPI team, did the work to age adjust. As we all know, vaccines were rolled out to the highest risk groups first. They had the first access, and many of those risk conditions are age dependent, as well as the disease is age dependent. So that is the reason why we did really work to age stratify with the different age groups and age adjust and provide rates in that way. That is consistent. CDC has released the same information, and as Dr. Linfield talked about the MMWR that Minnesota was a part of that was released in early September, that was consistent with how those data were presented there as well. There is a really, really great, I think, video explaining vaccine breakthroughs and explaining that possibility of misinterpretation on that vaccine breakthrough website that was put together by a communications team. I think it really explains, as you increase the proportion of the population that's vaccinated, you can misinterpret that an increase in vaccine breakthrough means decrease in vaccine efficacy when it really means an increase in that denominator. Dr. Linfield, anything you'd like to add to that?
No, I think you covered it well. Thank you.
Thanks a lot.
Operator, we have time for one more question.
Your last question comes from the line of Tim Blotz from Fox 9. Your line is open.
Hi, thanks so much, everyone. Deeply appreciate it. I'm going to follow up just briefly on the question from Bill and Catherine here a few moments ago regarding the White House announcement. Do we have any idea how many shots we are going to be allocated here in Minnesota once the CDC gives approval for vaccines for the children? Thank you.
Yeah, I can. This is Commissioner Malcolm. What we know is that we're going to be getting, and I think this may have been covered nationally as well. We're going to be getting an initial, the word the federal folks have been using is bolus of vaccine, so a pretty robust supply of vaccine to be, ordered and pre-positioned in the state so that vaccines can start to be administered as soon as the approval is given. And so we will know those numbers, and then so that's the kind of the initial amount of vaccine we'll get. And in addition, pharmacies are going to get some number. We don't quite know the final numbers on that, but the pharmacies will be getting an additional amount from the federal government in this kind of first pre-positioning phase, if you will. And then we will be getting a weekly allocation thereafter. So, kind of back to the earlier phases of the campaign, of the vaccine campaign, where we had a statewide allocation that was done on a population basis or pro rata basis, and eventually, as the supply built up, that just became a system where providers could order whatever they needed whenever they needed it. But in the initial weeks, we'll have that allocation from the federal government to the state, and then directly to pharmacies from the feds. CDC has made an interesting point the other day that in terms of the supply, I mean, they're providing a pretty robust supply at the outset here. We'll have nationally 10 times the amount of vaccine available for a population that is 1/10 the size of the early focus on older people and certain population and certain professions. So. I think very long-winded way of saying we feel good about the fact that we'll be getting kind of more information on what our various providers have the capacity to do, and how that matches with the state's allocation just in the coming days, literally here, so that we are ready to go when the vaccines are approved.
Quick follow-up, Commissioner, so that it kind of sounds like what you're saying is you expect to have those doses in state before the official announcement, maybe, or the approval on November 4th, so that you can roll those out instantly. And do you anticipate having enough for the 34% of parents who are estimated to want to get those shots right away?
Yeah, that's exactly the intent and the goal, and I think that has sort of informed the Fed's strategy around giving this sort of large amount up front and then a regular weekly cadence thereafter, so that we can kind of staff up and have all the vaccinators have the doses that they need to meet that early demand. A lot of details really coming together just in the coming days, but again, we're looking at kind of a pro rata share for each state based on our share of the pediatric population. So the feds kind of have this national number, and then we work with a population-based formula after that.
Excellent. Thank you, Commissioner. Thanks, everyone.
And thank you for tuning in. That's a wrap for today's conference call from the Minnesota Department of Health. Just listening to Commissioner Jan Malcolm at the end there, answering questions from reporters here on NPR News. I'm Stephen John. Seemed to be some confusion about reporting on breakthrough cases. I'm not sure if we ever did get to the bottom of that. Malcolm said earlier that the MDH is going to post a new graph, a new chart to show breakthrough case information. And she continues to reiterate that the vaccine makes illness less severe, but you can still get sick, as is the case with any vaccine. The statistics are showing that if not fully vaccinated against COVID, you are 15 times more likely to end up in the hospital than those who have completed their inoculation regimen. And if you have not had your shot, you are 30 times more likely to die than those fully vaccinated. Pediatric units still tight. A number of hospitals around the state for kids showing 0 beds available. We'll have much more reporting on the conference call, the COVID situation in Minnesota. Stay tuned to NPR News online and on the air this afternoon. And in the meantime, now we're going to go off to Here and Now because they spoke today with Minnesota Senator Tina Smith.
The urgency of climate change is forcing Democrats in Washington to make some tough choices. They're on the verge of dropping a key part of a climate change plan that President Biden hopes to present in just days to world leaders at a major UN